They lied to you. For your entire life, they told you that masturbation was shameful, something you should leave behind as you grew older, something men your age shouldn't talk about or even think about anymore. But what if I told you that after 60, self pleasure isn't just acceptable? It might be one of the most important things you can do for your health? Hi, I'm Dr. Ada James, a urologist who has spent over a decade working exclusively with men's health. Today, I'm sharing 7 science backed truths about masturbation that could change how you think about aging, vitality, and your own body. If you believe men deserve honest, shame free information about their health, please like this video and subscribe. Let me know in the comments where you're watching from. Your support helps this message reach men who desperately need to hear it. Now, let's begin with the first truth and the biggest mistake older men make. Truth 1: rushing through self pleasure destroys your sensitivity. Over the years, I've sat across from countless men in my office, their voices quiet, their eyes filled with worry. They tell me the same thing: I don't feel anything anymore, or I can only finish one specific way. Here's what's happening. When you masturbate quickly and mechanically without awareness or connection, you're teaching your body a very specific pattern. The same grip, the same speed, the same outcome. Every single time, your brain learns this pattern, it locks onto it, and slowly your sensitivity fades. You need more pressure, more intensity, sometimes more extreme content just to feel something. This is how problems like porn-induced erectile dysfunction develop. Your nervous system literally forgets how to respond to gentle touch, to real intimacy, to natural sensation. The emotional damage is deep. You feel disconnected from your own body. You pull away from your partner. Confidence disappears. Loneliness settles in. But here's the hope. Your body can relearn. Your nervous system can heal. It starts by slowing down, by making self-touch intentional instead of automatic. No rushing, no performance pressure, just reconnection with feeling. Masturbation isn't your enemy. How you approach it is what matters. And while mindless pleasure causes harm, completely stopping creates a different kind of danger. Truth 2: avoiding ejaculation causes prostate problems. I once treated a man named David. He was 68 and waking up 6 times every night to urinate. He felt constant pressure, fullness, and a dull ache in his pelvis. When I asked when he last ejaculated, he laughed nervously. "Years ago, doctor. I thought men my age were supposed to stop all that." Here's what I explained to David. Your prostate doesn't retire when you stop ejaculating. It keeps producing fluid. And when that fluid isn't released regularly, it builds up inside. That buildup creates congestion, inflammation, discomfort. Your body becomes like a pot with no release valve. This leads to frequent urination, weak urine flow, pelvic pain, and increased infection risk. Long-term inflammation can even raise your prostate cancer risk. Researchers at Harvard discovered that men who ejaculated at least 21 times monthly had significantly lower prostate cancer rates than those who didn't. When David began masturbating again, not from lust, but from self-care, his symptoms improved. His sleep got better. His energy returned. You wouldn't ignore your heart health or blood pressure. Don't ignore your prostate. It needs regular movement and release. And there's one emotion that makes everything worse. Truth 3: shame destroys your mental and physical health. Many older men can't even say the word masturbation without looking away. Not because they're bad people, but because they were taught it was wrong. You grew up when touching yourself was called dirty or sinful. That shame didn't disappear with age. It went underground, shaping your relationship with your own body. Here's the medical reality. Shame is a stressor. It raises cortisol levels, it tightens your muscles, it floods your brain with anxiety. Over years, chronic shame contributes to depression, heart disease, weakened immunity, and cognitive decline. Masturbation, done consciously, releases dopamine, oxytocin, and endorphins, your body's natural mood lifters. It improves sleep quality. It helps emotional balance. When you avoid self-touch because of shame, you're not just denying pleasure, you're denying healing. I worked with a 72-year-old widower who hadn't masturbated in over 10 years. He wasn't physically sick, but he was emotionally numb, disconnected, lonely. We worked together to rebuild his relationship with his body. Within weeks, something changed. He laughed again. He slept better. His blood pressure dropped. He wasn't just alive anymore. He felt alive. You are never too old to touch yourself with kindness, dignity, and purpose. Truth 4. Sexual activity keeps your testosterone healthy. Most men think testosterone just naturally drops with age. That's only partially true. Yes, it can decline, but it drops much faster when you completely stop engaging with your sexual energy. When you stop self-pleasuring, your body gets a message. He doesn't need this system anymore, so it downregulates testosterone production. Muscles soften, fat increases, energy disappears, confidence fades. But when you reawaken that energy through intentional touch, your brain receives a different signal. He's still here. He still needs this. That signal boosts testosterone, strengthens heart function, and improves mood. I treated Frank, a 73-year-old retired firefighter. He told me, "I just don't feel like myself anymore." His testosterone was extremely low. We worked together without medication, just lifestyle changes and reconnection with his body. He started self-pleasuring again, exercising, and sleeping better. 3 months later, he stood taller. He spoke with confidence. His lab results showed dramatic improvement. Your sexual energy isn't just about sex, it's about being fully alive. Truth 5, your erection system needs regular use. Your penis is a vascular organ. It depends on blood flow, nerve health, and cardiovascular function. If you stop having erections, whether through sex or masturbation, your body gradually shuts that system down. The smooth muscle tissue loses elasticity, blood vessels stiffen, oxygen flow decreases. Over time, you can lose natural function permanently. Think about it this way: if you stopped walking for years, your legs would weaken. If you stop having erections, your penile tissue atrophies. Regular erections, even through solo touch, keep blood flowing, nerves responsive, and tissue healthy. This isn't about performance. It's about preservation. It's preventive medicine. And if you're wondering why maintaining erections has become harder, there's one modern factor rewiring men's brains daily. Truth 6. Pornography rewires your brain, but you can reverse it. Let's be honest about pornography. Today's porn is completely different from decades ago. It's extremely stimulating, fast-paced, high-intensity, and endless. Your brain wasn't designed for this dopamine flood. Each click delivers a reward hit. Over time, your brain stops responding to normal touch. It craves novelty and intensity instead. That's why many older men tell me they can achieve erections with porn, but not with a real partner, or not at all. This isn't moral judgment, it's biological fact. Your brain is being overstimulated into numbness. But here's the encouraging news: you can rewire it. Your brain stays flexible even in your 60s, 70s, and beyond. Start with a 30-day break. No porn, no fantasy, no artificial triggers. Then slowly reintroduce natural touch, imagination, and connection. Within weeks, your body begins remembering how to feel again. You're not broken, you're retrainable. Truth 7. Mindful self-touch extends your life quality. When you touch yourself with presence, gratitude, and intention, your entire biology shifts. Your breathing slows, your heart rate stabilizes. Oxytocin and endorphins flood your system, lowering blood pressure and inflammation. This isn't indulgence, it's vitality. It's caring for your nervous system. When men practice mindful self-touch regularly, research shows better sleep, reduced anxiety, improved circulation, stronger immune response, and emotionally, it rebuilds confidence. You start looking at yourself differently. You carry yourself like a man who's alive, not waiting for life to end. Your action plan. Here's what to do starting today. Release shame. You've done nothing wrong. You're taking charge of your health. Slow down. Focus on sensation, not speed. Skip the porn. Rebuild your natural body connection. Stay consistent. Make this part of your wellness routine. Notice changes. Track improved sleep, mood, and energy. Aging doesn't mean disappearing. You still deserve touch, connection, and pleasure. You still deserve to feel vital. You've spent decades giving to others. Now it's time to give back to yourself. To every man watching, you are not broken, you are not finished, and you are not too old to reclaim your body. You have the power to restore what time has dulled, to feel alive, confident, and grounded again. If this message resonated with you, leave a yes in the comments. Hit the like button and subscribe for more science based, shame free health information for men over 50. This is Dr. Ada James reminding you your age doesn't define your vitality, your awareness does. Stay strong, stay curious, and stay connected to yourself because your best years might just be starting now.